So the first question says, the registered nurse is supervising UAP. And once again, this is really the most common way I've seen NCLEX questions on delegation formatted, where it's the UAP we are delegating to. So which task would be most appropriate for the nurse to assign to a UAP? And our options are perform incontinence care for a newly admitted client who has a cervical spine injury, assist a client who had an above the knee amputation 2 days ago into the prone position, reposition a client with increased intracranial pressure who has decreased level of consciousness, and the last option, demonstrate use of continuous passive motion for a client who underwent a knee replacement. So let's look at each option a little more closely. So performing incontinence care for a newly admitted client with a cervical spine injury. So what do we think? Yes or no? Should we delegate this task to a UAP, an unlicensed assistive personnel? I do not think it is appropriate to delegate this task. I agree with you guys, and let me tell you why. If we just see the words incontinence care, that seems like a routine task, and that's why it's very important that we don't just latch on to certain words. We have to look at the whole context. It's very important anytime you're sitting down and practicing questions or taking the NCLEX. Look at the whole content. So this is newly admitted client. So any client that is newly admitted is considered unstable because it is assumed that that registered nurse has not yet been able to perform a thorough assessment on that client. So that's a helpful NCLEX tip. Anytime you see newly admitted client or a client that just returned from a procedure, that is considered an unstable client. And remember, we don't ever delegate on unstable clients. But also, there's another learning opportunity here for us in this option. Anytime you have a client that has a spine injury, and you need to perform incontinence care, that is not really a routine task. There is a special technique we use. I'm sure many of y'all are familiar with it, the log roll technique. So if we don't turn that patient very carefully with help, we can make that spinal injury worse. So that's really a non-routine task. And once again, our client is unstable. So I agree with you guys. I don't like that idea. So you guys love option 2. So let's see if y'all are correct. So assist a client who had an above the knee amputation 2 days ago into the prone position. So AKA 2 days ago. So we can assume that a client that had a knee amputation 2 days ago is probably pretty stable. And so we're just being asked to reposition them into the prone position. So do we like this idea? Yes or no? Are we going to delegate repositioning this client? So I agree with you guys that this would probably be appropriate to delegate, but we haven't looked at our other options. So this client, once again, had surgery 2 days ago, so chances are they're pretty stable, and all we're doing is repositioning them, which is a routine task. Now, bonus question. Why would we even reposition a client after an above the knee amputation into the prone position? Does anybody remember that? Winnie, you said past 12 hours post-op are considered stable. Yeah, that's a good rule. Typically after that first 12 to 24 hours or so, that client is considered stable. So we want to prevent contractures. So placing a client that just had a knee amputation a couple days ago into the prone position, we're going to typically do that a couple of times throughout the day to prevent contractures. So great job, Leah. I'm super impressed. That was a bonus question for you. So once again, I like this, but let's look at our other options. So option 3. Reposition a client with increased intracranial pressure who has decreased level of consciousness or decreased LOC. Do we want to delegate this? So I feel like most of y'all are going to tell me no, and I'm going to agree because we have a client who seems pretty unstable, okay? Decreased level of consciousness is typically not a good thing with any client. That is an indication your client is unstable. But we're also concerned because this client already has increased intracranial pressure and we are repositioning them. So what happens if I have a client with increased intracranial pressure and I position them incorrectly? Maybe I lower the head of the bed or I even place them in a supine position. What's going to happen? It's going to increase that ICP more. So I can actually make that client a lot worse. Certainly, like I said, an unstable client. So we are not going to delegate that. So let's look at option 4. Demonstrate use of a CPM device or continuous passive motion device for a client who underwent a knee replacement. So that seems pretty simple. So do we want to delegate that? Yes or no? So I'm not going to delegate that, even though it sounds simple, because the words demonstrate use are just another way to say educate, okay? So very good, Winnie. Teaching, yes. So we cannot have the UAP performing steps of the nursing process. They cannot do client teaching, because remember, that is a tape task, which UAPs cannot do. So that teaching, okay, we got that correct. So awesome job.